Hi, Katie. How are you?
All right, there we are. Okay, do you want me to share the screen now so people kind of see the first slide?
Sure. I'm going to make you the host so that you have full access. Change host.
Okay. Perfect. Share screen.
Excuse me.
Okay, so that good like that?
Yes, that's perfect. If I make my screen big. Oh, yeah, that's great.
Okay, perfect.
Awesome. Okay, we'll get going in just a couple minutes.
Cool.
Okay, and you didn't have any issues with the most updated copy that I sent you?
No, it should be it. Yeah, you're there, so we're good.
Amazing. Okay, good. I'm really hoping that my daughter, I've locked the door, but if you hear someone trying to break in, she's already twice, but fingers crossed.
Okay.
How this goes. My husband is supposed to be looking out for her, so we'll see.
Fingers crossed.
Yeah, that's it. I know a few people messaged me saying they're coming, but they're going to be a little bit late, so
okay.
we might as well just get started. Okay, I've got chat open. Okay. Sorry, just give me 1 second here.
Mm-hmm.
Great. Okay, awesome. Okay. So we are here tonight to talk about skin health, anti-aging, and cosmetic acupuncture. Do you want to just flip over to the next slide, Kate? Amazing, great. So my name is Dr. Ashlyn Lanigan. I'm a naturopathic doctor, and I'm also the founder of Flourish. So Flourish, the idea behind it, it is a one-stop shop for everything a woman needs to up-level their health. And my clinical focus is really in fertility, although I do treat a lot of different women's health conditions. And I got really interested in, my friends that know me will say that I'm very, my vice is definitely like clean beauty products. So, and this kind of started like further back than this, but when I remember distinctly is when I got pregnant with my daughter, my little girl Frankie. I started looking at some of the things I was putting on my skin, and I tried to choose sort of like organic products and that type of thing, but I started getting really into it, and I wasn't using any prescription creams or anything like that, but just sort of like conventional stuff that I would buy at Sephora or wherever. And I started looking at some of the ingredients and the impact that it might be having on my pregnancy, as well as on my hormones, on my liver, on disease risk in the future. And I was horrified. And so I immediately went home and threw out most of what I had in my vanity at home, and switched over all my makeup, all my creams, all my stuff. And I do think that this is a really common thing that women go through, and we tend to think about it as soon as we're pregnant. And I would say every pregnant patient that I see, they come in and they're like, can I keep using this cream? Can I keep using my like vitamin A cream? And I'm always like, no, you definitely can't keep using that. And so over the years, what I've done is I kind of dabbled in skincare. So I did a few continuing ed courses, but I got to the point where I either needed to fully commit or I needed to surround myself with women's health experts that already knew it all. And so when I started putting together the team for Flourish, I decided I was going to go with option number 2. And so that's, so I'm so excited today to have Dr. Katie Black with us. So Katie is a naturopathic doctor. She will be at Flourish. She's already here doing virtual stuff for Flourish, but when we open, which is very soon on July 15th, she will be at Flourish seeing patients. And I'm really pumped about this because we've invested at Flourish in some diagnostic equipment for assessing skin. So whether you tend more towards dry or oily, and also sun damage and things like that too. So there are 2 naturopaths at Flourish that are really focused on skin health, and Katie is one of them. So I'm so excited to have her on the team, and I'll let her tell you a little bit about herself now.
All right. For anybody who doesn't know me, I'm Dr. Katie, and I am, practicing here in Toronto. And in addition to skin health and anti-aging, I do also have a big passion for fertility and women's reproductive health.
She's a
But tonight,
perfect.
tonight we're not talking about that. We're chatting about skin health. So my hope is that you guys are going to be able to, learn a few new things about your skin health, learn some tips and some tricks for things that you can start to implement into your skincare routine now. So my, main message or my way of practice with women is really getting people to embrace that, health and healthy living is much more than living a life that's simply disease and symptom free. I really want people to, cultivate a life of happiness and love and passion and connecting with all the people around us. And I really try to empower my patients to not only, recognize that they possess the power to make changes, but also ultimately maintain them. And I'm really here to share my knowledge, help guide you, be your cheerleader, kick you in the butt when you need one, and just, ensure that you have all the information that you need in order to make those informed decisions about your health. So this is kind of the general guideline of some things we're going to chat about tonight. We'll go through some of the Skin Health 101 things, how some of your hormones can impact your skin, stress, your thyroid, diet, and nutrition. We will touch upon ingredients to avoid and why, although we could probably talk for 6 hours just on this topic alone, but I'll try and be quick. We will chat about skincare routines, some of the basic steps that you can start to incorporate now, some of the do's and don'ts, and some of the products and brands that I personally love and that I also recommend to patients. We will chat about cosmetic acupuncture, what it is, how it works, jade rolling and gua sha and why they are both, pretty big beauty brands right now. And then some LED light therapy, what it is and how it works. And we are going to do some quiz questions at the end for prizes. So make sure you guys are paying attention.
Some of our bonuses I'll just share. So I know a few of you have been at a couple of our webinars. So we always send out the recorded webinar afterwards, but we have bonuses for people that attend live. So one of the things is we'll give you an invite to join our private Flourish Females Facebook group. And so this group is an opportunity to ask questions to the women's health team at Flourish, to also just gain information from the other women that are part of the group. We post all the recorded webinars. We'll start posting a lot more stuff as we get rolling. So do please take advantage of that. And then I'll let Dr. Katie talk about the other stuff because the other stuff is all her.
So Beauty Counter is one of the companies that I personally love and utilize. So I have some of their samples, their anti-aging line and their hydrating line. So two of those will be prizes for you guys to win. And then you also have the option or the ability to win a gua sha tool and or a jade roller.
So some super cool stuff.
So this little baby meme made me laugh. So let's dive right in. So most of the time when we think of skin, we don't often think of it as an organ because it's on the outside of our body, but it is actually the largest organ that we have, and it is composed of three main layers: the epidermis, the dermis, and the hypodermis. And the epidermis is that first level, right? It's that most outer layer that you can physically touch. And this layer is what actually protects our underlying tissues from chemicals, mechanical stress, dehydration, and infection. And it's this layer that's actually composed of melanocytes, which produce melanin, which actually gives your skin the pigment color. The dermis is that second layer. That's where you will find your collagen and elastin. So this is the layer of our skin that becomes our, enemy as we age, because this is the one that's responsible for all those fine lines and wrinkles. And then the hypodermis is that last layer, which you can see is composed of fatty tissue, veins, and arteries. Estrogen is probably, or at least arguably, one of the most well-known female hormones. And we know that it's important when it comes to our reproductive health, but you can see that it is really important for a lot of other roles in the body. You know, it does play a role in our memory, in our production of cholesterol, in regulating body temperature, in our bone density. But when it, you know, we talk specifically about skin, it does play three major roles. And it is responsible for maintaining our skin moisture. It's responsible for our collagen production, and it is responsible for the actual thickness of our skin. As we age and as women, when we go through menopause, right, we stop producing as much estrogen. And this is when we kind of see some of these effects where our skin becomes a lot thinner. We are getting wrinkles, and not only are they multiplying, but they're also getting deeper. We are losing some of that skin firmness and elasticity, and we're also finding that our skin can get a lot more dry as well.
That picture could be my forehead.
Mine too, so don't feel bad. Testosterone is another big hormone, right? A lot of the times we think of it as more of like a male hormone, but it does play a lot of roles in women's health as well. And when we talk about skin specifically, it plays a big role in sebum production or oil. So our sebaceous glands or our sweat glands are what produce oil. And when we have an overproduction of them, this is when those pores can get clogged, and it can clog hair follicles, which can lead to pustules and pimples and unwanted acne. And for a lot of women who are on the birth control pill, rebound acne is also a big thing, because the pill kind of works to suppress the oil production, but our body uses it as a natural defense mechanism. So your body is wondering what the heck's going on, and it's trying to increase more oil production. So then when you finally do come off the pill, your body is still in overdrive for oil production. Fun fact, men actually have a 20% thicker epidermis layer than women, which means they are able to bind more moisture and actually have more collagen than women, which in my opinion is totally not fair. So when we talk about thyroid gland, we, generally know that it's responsible for our metabolism and body temperature regulation, and can play a role in muscle tone and function, but it also plays a big role in our skin health. And while the thyroid gland directly doesn't affect our skin, it is how the thyroid gland responds to other hormones that play a role in our skin health. So when we have an underactive thyroid, you can see that it can cause drying of the skin, rough skin, thinner skin, flaky skin. And then when we have an overproduction of the thyroid gland, that's when we can see certain cases being linked with psoriasis and eczema. Stress, we know, is nobody's friend, but when it comes to our skin, it can impact it in a negative way. It can upregulate more sebum production, which can lead again to blocked pores and cause breakouts. It can actually speed up the aging process, so it can cause more wrinkles, age spots, can produce a duller complexion. It has the ability to break down collagen and elastin. It can, impact how we are able to retain water, so it can produce more dry skin. And ultimately, stress can weaken our immune system, which, can make us more susceptible to bacterial issues on our skin, and can take our skin longer times to actually heal. Water, we know, is essential to life, but funny enough, 30% of the water found in our bodies is actually found in our skin. So it is really important when you are looking for that bright, plump complexion to make sure you're hydrating well, because it also helps to maintain the skin's elasticity. When we chat about nutrition, again, we could talk about this for a whole other segment, but sugar, refined carbs, and dairy can be three foods that can, really affect our skin. Sugar and refined carbs specifically actually break down collagen and elastin. And it does that by a process called glycation, which the digested sugar actually attaches itself to the collagen and breaks it down. Again, sugar can weaken our immune system, which can cause, bacteria to build up, block pores, clog pores, and cause acne. When we have skin that's more dehydrated, again, our body will increase sebum production to, utilize it as a defense mechanism so it can increase that secretion. And then it can disrupt insulin levels, which can increase the activity of our androgen hormones like our testosterone. Dairy, again, one of those things that's super inflammatory in nature. It can affect our hormones and disrupt our natural hormone levels, which can cause acne because it can cause a lot of inflammation in the digestive tract, right? What's going on in your digestive tract is often, it shows on your skin. It can disrupt insulin and how you are able to utilize insulin in the body. There was a study actually that showed individuals who consume dairy every single day were actually 4 times more likely to suffer from acne. So for a lot of patients, simple things like removing or reducing the amount of dairy we have can actually have a really big improvement in our skin.
I get the question all the time if it matters, like milk versus cheese versus yogurt. It's all the same.
I have found it to be all the same just because, it's same product.
Mm-hmm.
But it can vary, person to person. But I would say if you tend to be sensitive with one of those products, chances are they'll all be, yeah. So skincare ingredients to avoid. These are some of the big guys. But again, like I mentioned, there are so many that you really want to avoid. But parabens, for one, they are actually used as a preservative in the beauty care industry, and they have the ability to actually mimic estrogen and bind to estrogen receptors in the body. So research is showing that when our body sees this influx of estrogen above healthy or normal ranges, this is when it can trigger some of those reactions like increasing breast cell division or growth of tumors. And it's been linked to countless cases of breast cancer, reproductive toxicity, a disruption in thyroid function. And when they've done studies, they've actually found traces of it in not only breast milk, but semen, bile, urine, and breast tissue. So we're able to, now recognize that it's not just staying on our skin, it's actually flooding every other aspect within our bodies.
And it's so crazy. Like if you start looking at ingredients, like conventional products, all have parabens. Like even I was looking into like lubricants for a patient that's trying to get pregnant, and she was using Pre-Seed, which is like marketed as this kind of like natural lubricant, and it had parabens in it, which is insane. Like you're literally secreting something that's messing with your hormones directly in that area.
I know.
Yeah, it's wild. Don't use Pre-Seed. Yes, baby. Okay.
So synthetic fragrances, perfumes, and parfums are all what we call EDCs, or endocrine disrupting chemicals, because they, again, disrupt how your body's natural hormones work. The biggest issue with fragrances is in the beauty care world, it's actually considered a trade secret. So companies don't actually have to disclose what their trade secret for their scent is. So you don't know if it's 2 chemicals or 200 chemicals. So my advice for everybody, if you have a product that says fragrance or, perfume on it, just chuck it out, or just put it back on the shelf. It's really, truly not worth purchasing.
Because it can be one of an 8,000 of things, right? Like any, exactly. There's like a list of things. Yeah.
Totally. And the research is showing that it's also been linked to allergies and asthma, in addition to cancer. It's, there's been studies where there's shown some birth defects in babies, and weight gain, and migraines, and dizziness. Like it just causes so many things that it's one of those things, just, put back on the shelf.
If you look at even like conventional baby products, like I'm not gonna bash any more brands right now, but I remember like for my first baby, we got lots of like baskets of baby skin stuff, and it would all of them would have like fragrance as the last ingredient. So yeah, you want to take a look at those for sure.
Yeah, reading your ingredient list and learning what things to avoid is part of the process, right?
Mm-hmm.
Butoxyethanol is, found in a lot of cosmetics and in a lot of soaps, but it's also found in paint and varnishes. So I don't know why you'd want to put that on your skin either. It is absorbed directly through the skin, but also via the lungs. So high levels of this in humans have been linked to pulmonary edema, as well as liver and kidney damage. Phthalates is another one that's a big one. It's a plasticizing chemical, and this one has particularly been linked to endometriosis and breast cancer. Triclosan is another one found in a ton of products, especially antibacterial products. But the funny thing is it actually reduces our bacterial resistance. So even though you're trying to get bacterial benefits, you're also now, your body's not able to fight off some of those bacteria by using them. So that is an issue, as well as, its ability to disrupt our hormones as well. And they are actually finding a lot of this particular, ingredient in our lakes and our oceans and our rivers. So, anyone who has a cottage or camp or goes camping, it's one of those ingredients that you want to make sure whatever products you're bringing with you to kind of, shower in the lake, so to speak, that you're not causing more harm to wildlife and stuff as well. And then formaldehyde, that's another one. I'm not finding it as much in products because we've, a lot of products have taken it out, but it is something that is used as a preservative. And it, again, carcinogen, asthma, neurotoxicity, etc.
And that's in a lot of hair stuff, right? Formaldehyde, like in a lot of like hair straightening type things. That's what I see it the most.
Yeah.
What do you think about the Skin Deep app by Environmental Working Group for looking up ingredients of things?
It's great. It really gives you, a general screening tool. There is an app called Think Dirty as well that you can use. It doesn't have all the products, but it definitely lets you at least pre-screen some of the stuff that you do have at home. So those are definitely two tools that you can look things up at home.
Awesome.
So skincare routines, I feel like everybody's just like, tell me what to use on my face.
Yeah.
So a lot of people want to know, how do I layer my skin products? What's a serum? Why do I want to use an oil? What the heck's a toner? Can I use the same products in the morning as I can at night? What steps do I have to use? Which ones can I skip? And then like what products will give me, which benefits? So this is
Oh, wow.
basic, as basic as I could make it. But basically, yes, your morning and evening routine can be the same. Obviously, at night when you go to bed, you're not putting on sunscreen and you're not putting on makeup, right? So I would say those obviously are two steps that you can interchange depending on the time of day, but this is the basics. The first thing, wash your hands. It seems pretty straightforward, but a lot of the times we don't think about it, right? Like you're getting ready, you want to take your makeup off as fast as you can, brush your teeth and hop into bed. You're not thinking about, I need to wash my hands in order to put my products on. But at the end of the day, when you're going to be touching your face and you are going to be applying these really great products, you don't want to be adding bacteria, right? You want to just be adding the products to your skin. So that's like the first step. Then investing in a good cleanser, right? To make sure that you are getting rid of the, the makeup and the dirt and everything off of your skin. I personally like an oil cleanser. It's really gentle on your skin. It helps to emulsify a lot of the makeup and dirt and grime off your skin. But, I often will recommend gels or milks as well. I personally tend to shy away from the foams just because they all tend to be really drying and irritating for a lot of people's skin. And they also tend to be filled with a lot more crap. However, if you are someone who has a foaming cleanser at home and you've been utilizing it and it's been working for you and it's clean, there's no need to switch. It just depends on what works for you. The next step would be a
I have a
toner.
question, I
Yep.
have a question about the cleanser.
Totally.
So I've been really trying to switch to the oil-based cleansers because I know that I have dry skin and it would be so much better for me. But I
Yep.
find that they don't like I don't wear a ton of makeup generally, but like they don't get makeup off or like eye makeup off. And I really end up like scrubbing with a face cloth. Is that normal? Is that just par for the course with oil cleansers?
Yeah, kind of. I still use a makeup wipe remover first. So there's a brand KAIA. They are 100% organic bamboo, no additives. They actually have like vitamin E and some things in it. So you can utilize a makeup wipe first, and then you can use the oil cleanser after. So a toner is the next step. This can also be a hydrating mist or a skin essence. This is really used to kind of rebalance your skin pH to make sure that the products that you're applying on after you're able to absorb and get the most benefit from. And it does help to further reduce some of those skin impurities and get rid of, that extra makeup and dirt. Serums, I want everybody to think of as your treatment step. So whatever your goal is, whether it is to reduce fine lines and wrinkles, get rid of acne scars, reduce pigmentation, treat acne, brighten complexion, whatever it is, your serums are going to be the products that have those medicinal ingredients that will be able to help achieve those health goals or
And so this
skincare
is
goals.
something that you would like talk to you about or whatever to figure out what serum you should be using. Got it. Okay.
For sure. Because there's, I mean,
So many.
you can walk to any, right? Any store and there's like 50,000 brands and who knows what to grab, right? So yeah, you can definitely fine tune what you're looking for in those products by finding the right ones, depending on what your skincare goals are. And oil is the next step. And this one's really to just, lock in the benefits of all the previous steps that you've done to provide that extra protective layer and also to really focus on that moisture and hydrating aspect. And then again, your last step is your moisturizer, which is straightforward to, just really protect and moisturize our skin.
So the oil is not the moisturizer. You got to do both.
It is, but it works more truthfully to provide like that protective layer to your skin from more of those like environmental harsh factors. And then your moisturizer is able to kind of penetrate and get further down into the skin.
Okay, cool.
If it was nighttime, then I would say you could put your under eye on cream at that point. Some people do under eye cream first and then moisturizer. It totally depends. Those ones can be interchanged. Now, I know this is a lot of steps. So for anyone, that's first starting out, invest in a good cleanser, a toner, and a moisturizer. That will get you started. And then over time, you can start to incorporate serums and oils and play around with other things. But cleanser, toner, and moisturizer is a good basic to start.
Amazing. I kind of love all the steps.
Right? You get addicted to skincare very easily. You start trying all of the things all of the time. So here's a couple of extra skincare tips. Whenever you're applying your skincare products, don't ever pull down. You always want to put your skincare products on in an upward and outward direction. Just think like facelift, right? We are already battling gravity. We do not need to give her a hand anymore. So never down, always up and back. When it comes to utilizing the cleansers, always use cool water. Hot water can actually be more drying and more damaging for the skin. A lot of people want to kill two birds with one stone and cleanse in the shower, but don't do that. Do it separately. I don't personally even love lukewarm water, but cool water, truthfully, if you can handle it, is the best. If you feel like you're ever getting a pimple or a breakout that's happening and it's kind of, hard and cystic under the skin, applying an ice cube to it can actually help reduce inflammation and get the pimple to dissolve a little bit faster. You can also use castor oil as another option to kind of reduce the size of the pimple, but you don't want to leave castor oil on because it's actually comedogenic, which means it can actually cause more breakouts. You want to make sure you wash it off after, 20 or 30 minutes. Consistency is key, right? The longer we are consistent with our skincare routine, the longer the results will last, the, you know, more benefits we're able to get. And ultimately, at the end of the day, you can have the best skincare products in the entire world, but if you aren't treating what's going on from an internal perspective, it won't fix it. So skincare is really important for the external part, but we also need to be treating what's going on from an internal perspective as well. So some skincare ingredients and supplements that are, you know, pretty popular right now. Collagen is all the rage right now. It really works to revitalize and firm skin. It's really important for elasticity and moisture. As much as I wish we could drink collagen and tell it to get rid of those fine lines on our forehead, we can't actually tell it where to go, but, you know, it will have some benefit because it is also, you know, a protein. It is found in our joints and ligaments and everything like that. So collagen in general, it's one of those supplements you can kill multiple, you know, kill two birds with one stone kind of thing. Hyaluronic acid is something that's being found in a lot of serums right now for hydration. And it does work by drawing water content and moisture into that upper layer of the skin. So it can kind of give that more like plump visibility on the skin, but it isn't, again, under like addressing the underlying skin dryness. So again, it's like something you can utilize, but you would, you know, benefit from some other things for more dry skin. Vitamin C is a really powerful antioxidant. It works, you know, really well for reducing hyperpigmentation, brightening our skin complexion, boosting collagen synthesis, and it does help to protect our skin from UVA and UVB rays. So although we can't use it instead of sunscreen, it can at least provide some additional benefits there. And then vitamin A can be used to treat acne, and, you know, by reducing sebum or oil production. It can help a little bit to reduce pore size, but ultimately pore size can't really be changed all that much. It does help to unclog pores and repair, you know, some of the cellular structure of the epidermis to kind of improve hydration.
And are you talking about taking this stuff internally or some internal, some external?
So collagen would be the internal one. The other three would be topically in serums or oils and things like that.
Cool.
All right.
Oh my goodness.
Everyone always gets freaked out when they see me do cosmetic acupuncture on myself, but hey, why not reap the benefits? So cosmetic acupuncture, right? It's become a really big beauty trend for a lot of people. It is totally safe. It's non-toxic. It's non-surgical approach, right, to reducing fine lines and wrinkles. A lot of people now are shying away from wanting to jump towards Botox because they want to do things at a more natural way. But I also have patients that do both, right? So some of my patients will see me for cosmetic acupuncture and then go for Botox. And because cosmetic acupuncture can actually help to prolong the effects of Botox, people are able to go for less Botox. So that's one bonus. Probably the biggest thing is people want to know how it works. So when we, you know, insert a needle into the skin, it actually, the body views this as a micro trauma. And what happens is, you know, it stimulates our body's natural repair system. So we have an influx of blood flow and nutrients and proteins, two of which are collagen and elastin, to that area to help heal and repair it. So we're actually able to stimulate collagen exactly where we want it at the site of the needle. And when we are increasing circulation and we're promoting a healthier lymphatic drainage, we're able to eliminate a lot of those toxins and give your skin that really bright, natural glow that we're all hoping for. And we're able to improve muscle tone and, you know, reduce acne scars and pigmentation as well. In terms of treatments, generally it's 8 to 12 sessions. I always recommend everybody do one session once a week for the 8 or 12 weeks, or we can do 2 sessions, a week for 4 weeks. And then follow-ups really just depend on you and your skin and how, you respond to the acupuncture. But generally it's like one treatment once every 2, 3, or 4 months. And again, that really just depends on person to person. And then I generally recommend that once a year you do, 6 or 8 treatments just to kind of boost that collagen again. And then when you do come to see me for cosmetic acupuncture, we do an initial intake as well, so that we are looking to find any of those underlying health issues to be able to target and address them as well.
Very cool.
Now, LED light therapy is a new therapy kind of on the market. There aren't actually very many of us in Toronto that are doing it, so that's kind of neat. It is both Health Canada and FDA approved, and basically think of it as a battery charger for compromised cells. So any cells that, need a little boost, the light will actually be absorbed into those cells and have biochemical and cellular changes. But it doesn't actually penetrate healthy cells. So you don't ever have to worry about it damaging healthy cells. A lot of people think that it's UV light, like a tanning bed, but it's not. It doesn't work that way. So it's totally safe to use. Fun fact,
Like while you're doing cosmetic acupuncture, like at the same time?
Yeah, so a lot of the time what we'll do is we'll put the needles in and then we'll put the LED light on top, and then you get both benefits. And the light actually continues to have clinical benefit for up to 24 hours.
So cool.
So you get to finish your treatment and still reap the benefits for the next day.
I will definitely be doing all of this.
Yeah, so initially, funny enough, the technology was created by NASA to utilize up in space for healing and tissue repair in the 1960s. And then later on, the military began to utilize the technology as well. And then here we are now that we're able to utilize it for skin health now. The actual treatment length is 30 minutes. Because it has 3 lights that are emitted, there's a blue light, a red light, and an infrared light. You can use it for a ton of different things, not just related to skin, right? So the blue light really kills surface bacteria or acne causing bacteria. So if you are someone that's coming in for, acne treatments and you want to utilize cosmetic acupuncture to target that, we can also kill some of the surface bacteria by using the LED machine as well. Then the red light is the one that stimulates collagen synthesis. So you can utilize that for fine lines and wrinkles. And then the infrared is really great for reducing inflammation, to reduce bruising. So it's great like post-op. It helps to repair wounds, can be used for osteoarthritis. I've even had a couple of male patients come in because they were crazy mountain bikers and sprained ankles, and we utilized it to kind of speed up recovery. So you can utilize this for a ton of things. It's not just for your skin. There are, of course, some contraindications, right? Some situations where we can't use it because it's not been tested in pregnancy. We always err on the side of caution. But epilepsy and seizures, can't use it either. And then if you are on any medication where photosensitivity is a side effect, you wouldn't use it. And if you have, recently used Accutane for acne, you wouldn't be able to utilize this therapy for a couple of months. So jade rolling and gua sha. So jade roller is on the left-hand side and gua sha is on the right. Both are utilized to enhance circulation, promote lymphatic drainage. By doing so, again, we're able to reduce fine lines and wrinkles. We can reduce tissue adhesions in the face that can worsen fine lines and wrinkles. We are able to tighten and tone the skin. I've had some success with patients utilizing it for TMJ to be able to help really get into some of those muscles that are causing some of that discomfort. The difference between the two of them, Jade rolling you can utilize directly on the skin. You don't have to put anything on the skin to utilize the tool. Whereas gua sha, you actually need an oil on first for the tool to be able to glide easily over the skin. I think one of the biggest things that people don't do when it comes to utilizing these tools is utilizing it with enough pressure. It shouldn't feel like a gentle stroke, right? You should really see that the tissue is becoming quite rosy or pink, right? That's telling you that you are utilizing enough pressure, that there is adequate increase in blood flow and circulation to the face. So I often get people to utilize it first in front of the mirror just to kind of get an idea of the pressure that they should use, and then they can use it away from the mirror thereafter. You can absolutely use these daily. I am definitely someone, I hop in bed and I start doing my jade rolling before I fall asleep. Some people will do it twice a day. It's totally up to you. If you are someone who wakes up in the morning with some puffiness under the eye, even just holding the jade roller under your eye, because the stone is cold in nature, it will help to reduce that puffiness, or you can just do a gentle roll. When it comes to how to utilize the tools, you just want to start from the inside, like, the midline, and work your way out and back. There are some techniques and stuff which actually, we could, our next presentation, we could do a live like jade rolling and gua sha tutorial, and I can teach you guys how to do it. So maybe we'll save some of those things for that guy.
That sounds awesome. So the basics is like, think facelift, think like move it away.
Everything is back and up.
Okay, great. And actually, before we do, so people sent me some great questions from the Instagram poll, but one question came in the Q&A. Do you have a favorite brand of powdered collagen, Katie?
So there's so many, but Organica is one that I often recommend. Ancient Nutrition has one. Vital Proteins is another one a lot of people use. There's so many, but generally my first go-to is usually Organica.
Great, thank you. Okay, awesome. So other questions people had, and I actually hear this a lot, and it tends to be from my like supernatural patients where I'm like, what are you putting on your skin? And I know who this patient is that sent me this question, but I'm just, because I told her no, she couldn't use it, and she appears to still be using it, but I've just been using coconut oil on my face as a moisturizer. Is that okay?
I would agree, and I would say no. Coconut oil can be a great base if you are making masks at home and you're adding different ingredients, but it's not really one of those substances that you should be applying on your skin all of the time, unfortunately.
It's kind of the same as the castor oil, like
yeah, it can really clog pores and block them. So it's not something that I would say daily routine, but yeah, if you're someone that's making face masks at home, it's a great base to utilize for that.
Okay, amazing. Great. Okay, I also know who wrote this question. When I'm getting a cystic acne spot on my face, I take an Advil and I think it helps reduce the size severity. Does it?
I would say no. I've never actually heard of that before. I think for cystic acne, we really just have to address what's going on, right, from a hormonal standpoint, but try the ice cube trick, try the castor oil. I would refrain from utilizing Advil as your go-to first treatment option.
Definitely. Also, as we work our way through these questions, if you have any other questions about anything skin related, feel free to throw it into the chat. And as I say that, there's another question here. Is cosmetic acupuncture or the LED effective for treating postpartum melasma? Great question. And then is there anything internally or externally that's particularly helpful for treating melasma?
So there are a lot of great things topically that we can do for melasma. I actually truthfully haven't used the LED for melasma yet, so that would be something to try. I've had more success truthfully with custom formulated topical things for melasma than anything else.
So like
Sorry, you cut out there.
Sorry, something from like a compounding pharmacy?
Yeah, topical glutathione really works well.
Got it. And they would want to talk to you or to like a naturopath that that is an expert in skin health to get the right dosage and the right base and like all of that stuff.
Yeah.
Okay, great. So topical glutathione. Awesome. Cool. Okay. Another question. Should I use both a jade roller and a gua sha? I use only the jade roller right now.
You can use both, or you can just use one. When I see people for cosmetic acupuncture, I always finish their treatment off with a gua sha massage. I find gua sha is a little bit harder to do on yourself, right? Compared to having someone else do it for you. But you can achieve the same benefits from utilizing both. So it really doesn't matter. You don't have to use both, but you absolutely can, switch from using one to the other if you want.
Okay, next question. I'm afraid to come off the birth control pill because my skin might flare up. And we see this all the time as naturopaths. Like a lot of women are on the birth control pill and we're like, oh, you're trying to prevent pregnancy. And the patient's frequently like, no, I started it for heavy periods or skin or whatever. So what's your advice, Katie? And this is a loaded question. So also I'm going to send out an email after this with the recording and with all the things. And there'll be a link to book a free discovery call with Dr. Katie Black. So what that is, it's 15 minutes where you can be like, okay, this is my issue, and Katie would talk about generally how she would approach that. So this would probably be like fall into that category, but speak to this however you feel comfortable, Katie.
Yeah, it's definitely, so this is something I see a lot and I work with a lot of women. At the end of the day, the birth control is depleting a lot of key vitamins and minerals that are really important for skin health. So when we are coming off the birth control pill, what I tend to do is a couple months before a woman decides to come off it, that's when we start to replenish what the pill has been depleting, so that, when we make that transition off the pill, the body isn't going like, what the heck, where are all these things, right? And then depending on what else is going on, there are some other supplements that have, affinity for killing bacteria on the surface of the skin, which we can implement. So it really just depends. But yes, if anyone wants to chat about, how I might be able to help, definitely book in for a discovery call and we can chat. I'd be more than happy to do that.
Yeah, don't just risk it. Don't just come off the birth control pill and hope that it will all work out.
Yeah, for sure.
Another question here. Are there any benefits to applying probiotics topically in a homemade face mask?
Honestly, I haven't really seen that much difference because it just, probiotics have much more of an affinity for the gut, right? And replenishing and repopulating the bacteria, the good bacteria there. I don't think it's worth it. I would stick to taking the probiotics internally.
Right. And because a lot of the stuff you're putting on your face is to get rid of the bacteria on your face. You'd probably kill a lot of those anyways in the process of
and it would be something that you would be washing off anyways, right? So you get more benefit by taking that particular product internally.
Yeah, great. Does cosmetic acupuncture hurt?
No. Now, some spots on the face can be a little bit tender, but it absolutely doesn't hurt. I promise you, I wouldn't administer it to myself if it hurt because I wouldn't inflict pain. But yeah, for the most part, because it's going in through the tissue, right? You're not really feeling it. Some of the points around the mouth can be a little bit more tender just because there's, less meat, so to speak, there. But as a whole, no, it doesn't hurt.
Amazing. I remember being in school and learning like there's acupuncture points in the face to like revive an unconscious person.
Yeah.
one of my classmates did it on me and it was so painful. And so I've not actually ever had cosmetic acupuncture because that experience was so stressful.
Yeah, no.
But I'm definitely going to get it from you.
We don't use that point. Don't worry.
Amazing. The light thing, I feel like that was the LED light that Dr. Katie talked all about. So many great benefits. I feel like we don't need to necessarily go over that again. And that was because I posted a picture of Dr. Katie using it on Instagram. That's why somebody asked about it. Okay, one more question here, I think. I've heard that retinol should be avoided while pregnant or breastfeeding. Why is that?
It can be toxic, right? It can be teratogenic, so it's not something that we use in, women who are breastfeeding and or pregnant. There you can get, there's so many other topical options to achieve the same benefit. And retinol is actually one of those ingredients that is actually really irritating for a lot of people. I personally can't use it. I get like flaky skin like within using it like right away. So again, right, just because retinol worked for one person might not work for somebody else. So but yeah, it is one of those ones that's getting a lot of attention right now, and it does work, but it's definitely not the right decision or the right option for everybody.
Definitely. So not while pregnant because it can cause birth defects in the baby, which is obviously serious. And then breastfeeding, is it because it goes into the breast milk and then get higher levels of vitamin A in babe? Is that the rationale there? No. Okay.
It crosses into breast milk and can be given to the little one. So we want to avoid that one.
And being like a fat soluble vitamin, it's something that can accumulate in the body and can be harmful for the liver. So Katie, I'm sure, has a million other options for you other than retinol, which you should book a discovery call and talk to her about. Okay, and another question. Favorite face oil brand?
So I use Beauty Counter.
Mhm.
They are, I love their products so much and use them for so long that I actually became a consultant for them. So if anyone has questions about Beauty Counter, definitely reach out. I'm happy to make recommendations on their products, but they actually have a never list of over 1,800 chemicals that they refuse to put in their products. So a lot of their products also have the environmental working group stamp of approval, which is great. They also carry makeup. So I have their mascara and their eyebrow gel, right? Like you can, if you want to switch some of your makeup options, it's not just skincare. You can get sunscreen and body wash. So that's one that I personally use and recommend, but there's so many options. I even have a hard time keeping up with all these skincare lines.
I recently got, I think it's Wildcraft is the brand, which is like a local, I think it's Toronto, but it might be Ontario. And I'm loving it. It's like a really good ingredient face oil. I'll put both of those in the chat, but there's so many. So,
Yeah.
and also too, you probably want to like talk to Katie about which oil you're choosing, because depending on your skin and like your propensity to acne and a variety of other things, there's probably a specific one that's better for you.
For sure.
Amazing. Okay. Any other burning questions? I don't see any other ones in our chat here right now. So I'll keep an eye on it, Katie, but you can carry on.
All right.
So our bonuses. So it is time. So how it's going to work, and a bunch of you have been here before, so you know what's up. But posting in the chat and just making sure it says to all panelists and attendees when you post, the first person to post the right answer will win the prize. And maybe we'll say that that each person can only win once, just to be fair.
Yeah, that sounds good.
Okay, amazing. All right.
Okay, so first question, which will be for the anti-aging and makeup bag from Beauty Counter. Name one effect that low estrogen has on your skin.
This is tricky. Maggie says dehydration.
Perfect.
Okay, amazing. Maggie, I'm just going to note that down. Okay, great. Congratulations. So Maggie, I'll send you an email afterwards and we'll figure out how to get you your prize. Awesome. Okay.
All right. Next one is for the hydration skincare line sample, as well as another makeup bag. So this is name one chemical that you should avoid in your skincare products.
Oh, that's tricky. Fragrance. Jen Kitchen.
Yay. Good job.
Great. Taking a note. Okay, great.
All right. For the gua sha tool, Name one step or product in your skincare routine that you would classify as your treatment step. What would that step be called?
Simone's, oh wait, was it Simone or was it Shauna? Wash your hands. It was Shauna. Sorry. Sorry, Simone. Wash your
Nope.
hands.
Nope.
Oh, no, sorry. Okay, second answer. That might have been for the previous question. Simone says serum.
Yes, that's the one.
Great. Amazing. Okay, and that was for gua sha.
Gua sha, yeah.
Great. Okay. So
Last one.
Final one.
For the jade roller. Which
Jade.
skincare ingredient is known for its powerful antioxidant properties?
People are thinking. Laura says glutathione.
No, but it is an antioxidant. That's not wrong. Right.
Simone says vitamin C.
It is vitamin C.
Simone, you've already won the gua sha tool. Would you like the gua sha tool or the jade roller? And we'll pick another question. She wants a gua sha. Okay, so the jade roller is still up for grabs. Katie, I'm going to put you on the spot. Can you think of another question?
Name one layer of the skin.
Ooh. Epidermis, says Laura. Nicholas.
There we go. Yay.
Okay, great. Amazing. Just going to make a note here. Nicholas, jade roller. Okay, amazing. Good. Okay, so I'm just going to add Katie's favorite face oil, Beauty Counter. Mine is, at the moment, Wildcraft. Okay, awesome. Okay.
I think that's it.
Great. I'm just going to make sure that there are no remaining questions. Awesome. So thank you guys so much for being here. Thank you so much, Katie. That was so informative. Like even for myself as a naturopathic doctor, I feel like it was so great. So we will definitely do this again. Maybe we'll do a live, even maybe cosmetic acupuncture. Once Flourish opens, we could do something like that. So amazing. So thank you so much. So I'm going to send out an email, like I mentioned. There'll be an opportunity to book a discovery call with Katie. I'll send out the recorded webinar. So someone had messaged me asking for, sorry, I've got, Simone wants to know, can you still perform cosmetic acupuncture with COVID? Yes. So naturopaths are back to, non-essential and essential care. So we're back to our full scope. So what we're basically doing is we are in full PPE. So we are happy to see you in person. And we definitely need to be in person, obviously, to do acupuncture, to do IVs, to do B12 shots, something like that. For more consult style appointments, it's up to you. So if you really want that face-to-face, if you want to come in and into the office, you totally can, but we also offer virtual appointments. So it's sort of whatever you're comfortable with, but we're in PPE and we will have masks, ideally for you to wear as well too.
And also, if someone has benefits, you can totally get cosmetic acupuncture covered. So don't let them go to waste.
Yeah, exactly. So yeah, you can totally use your benefits for it. So I'm going to send an email that you'll be able to book a discovery call with Katie. So even if you're like, I'm not sure if cosmetic acupuncture is for me or whatever, book the call and then Katie can help you decide. I'll send the recording. Someone had asked for the slides. So the slide file is actually gigantic because of the pictures and the graphics and things like that in there. So I won't attach that, but what I will do is I'll send a link so you can always just go through the video and get whatever info you need from the slides that way. And there'll be a chance to join our Facebook group. And as I mentioned, Flourish is opening. So we've been an online hub now for a couple of months and we're opening July 15th. So yeah, if any women's health stuff you need, feel free to visit us there anytime. Sorry, one other question. How does someone go about getting trained in cosmetic acupuncture and where would you recommend training?
So you have to either have gone to the traditional Ontario College of Acupuncture, or you know, do your naturopathic medical degree. And then it isn't something that we're trained in school. It is an actual extra course that I went to get certified in. And I took it through the Ontario College of Traditional Chinese Medicine, which is where I got certified for.
And it is like, I looked into it 100 years ago, and it is like a very expensive, like it's a big investment course to do. So there's not that many naturopathic doctors or acupuncturists that do it.
Yeah, it's definitely it's a little niche, but it's a
Hmm.
lot of fun and I love it. So
Perspective. So yeah, amazing. So I will send out an email summarizing everything. If you have any questions, you can always book a discovery call with me. You can always email me or message me on one of our many different social links. So thank you so much again for being here, Katie, and thank you everyone. And I hope that we all have a great night.
thank you, everybody. I hope you guys all learned a little bit and we will chat later.
Awesome. Bye.
Bye.